is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
Are you pregnant during the COVID-19 or the coronavirus epidemic? It's natural to feel concerned, but please don't get stressed out because you need to keep your immune system in tip-top shape for the health of you and your baby. To help ease your fear, this podcast was specifically made just so that you would know what is the coronavirus, COVID-19, the current pregnancy and delivery cases, and what we can actually learn about them, and most importantly, how to stay safe and healthy to prevent contracting COVID-19 in today's episode of Pukeology Podcast. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now. Or just place No More Nausea Band on your baby registry for your delivery bag at Bye Bye Baby. Or get it shipped to you for free in just 2 days on Amazon as a Prime vendor. And remember, your little ones are always taken care of with the first No More Nausea Kids and No More Nausea Sleepless Nights Kids, a natural way to increase melatonin by putting them to bed sooner and keeping them asleep longer. Now available at your local CVS store. Pregnancy humor you'll hear that may just want to make you pee your pants. Like you don't have to pee all the time anyway, with hilarious puke stories such as sushi shot, strawberry festival, a little thank you gift, and double dose at the same time. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind the coronavirus, COVID-19. What are the symptoms of coronavirus versus the common cold, flu, and or allergies? The effect of the coronavirus in pregnancy and during delivery, and of course, tips to help you manage the COVID-19 virus in pregnancy, breastfeeding recommendations, and ways to help you actually prevent acquiring the coronavirus in pregnancy.
Throwing up on a Tuesday? One puke story.
So once a month, my girlfriends do what's called a ladies' night. And I was dying to go, but it was the first time during pregnancy, may I add. And again, this was the crew that I was the very first to get pregnant and married and have a baby. I was craving sushi, but I had heard that it wasn't a good idea. So I stuck with the cooked kind. I think my unborn baby read the same no sushi article. And the second I put that delicious looking roll in near my mouth and into my mouth, it came shooting back up. I hurled all over the sushi boat, started crying, and my friends still laugh about it to this day. Lauren Lamb, thank you so much for sharing your puke story. Living in Central Florida, strawberry season is a thing. I got a strawberry milkshake, a huge strawberry shortcake, and upgraded to get some vanilla ice cream on the cake. Looking back, I should have put into a diabetic coma, but that didn't happen. Instead, I managed to eat all of it. My family was stunned, and I went to the parking lot super happy, as though that is exactly what my unborn child wanted. As I got to the car, my earring fell off, so I bent over to pick it up and felt the valve of my stomach explode. Everything I just ate came up and dyed my white shoes red. What's even worse is that I wanted to go back inside and order it again because it tasted so good coming back up as it did back down. Pregnancy cravings, can't live with them, and you can't live without them. Thanks, Angie Buttathang, for your hilarious puke story. I got the rotavirus when I was 7 months pregnant. It's still by far the worst sickness that I've ever had. Every time I vomited, it would come out with such force that my other hole had to match it. If you've never had to SHIT on the wall behind you when throwing up, and then you fall over because of exhaustion and stared at the brown stuff like a Rorschach psychological symbol out of exhaustion, you've never had a virus when you're pregnant. I literally couldn't control what was coming out of the top and bottom. So it was so bad that my husband still refuses to buy Lysol scented lemonade or Lysol scent cleaning solution because he was the one cleaning after the Virugeddon. Thanks, Tish Kuhn. Do you have a hilarious puke story that you just can't wait to share with me? Send it. Pukeology, Pukeology @nomonaja.com, or just tweet us at Pukeology so we can all have a good laugh.
The science of puke. Pukeology.
All right. So what is this coronavirus? You hear things that it can live on surface items or surface areas for days. You also know that it can stay on cardboard for a little less than 24 hours. So what exactly is it? Well, the coronavirus, COVID-19, is actually part of the coronavirus family. They're a large family of different viruses that are transmitted between animals such as cats and camels, and unfortunately humans, other mammalian species. Some reported coronavirus illness have included some of their distant type cousins, which were the Middle Eastern Respiratory Syndrome, that's the MERS, MERS, CoV, and the Severe Acute Respiratory Syndrome, SARS. Currently, there is an outbreak of this new coronavirus strain that has never been encountered before, and they titled it COVID-19. This acronym is actually short for coronavirus in 2019, which was the year that it was first recorded. The word coronavirus should actually not be capitalized unless it is used in the heading or abbreviated in the COVID-19. And all of these acronyms and all this stuff was actually stated by the Center of Disease Control and Prevention, the CDC. Both SARS and MERS are coronavirus strains that the world has encountered before and can be thought as distant cousins, like we talked about. A nice family heirloom tree, right? Coronavirus, according to the Johns Hopkins University Center for Systems of Science and Engineering, the global death toll of COVID-19 was 5,547, while more than 148,930 people have been infected in more than 80 different countries, and that's as of 3/14/2020. Over 73,710 cases of coronavirus have actually recovered. And in the US alone, there have been over 2,340 cases, doubling the number of cases daily to 93 new cases just this last day, with a death toll here in our country of 50. The majority of the cases and deaths were actually recorded in China, where the outbreak started, with 3,189 total deaths recorded. So we do sympathize and mourn for all of those who they've lost. So we have to get control of it. Getting control of it means understanding what it is. Well, COVID-19 is actually a lower respiratory tract infection, meaning that the symptoms are felt in the chest and in the lungs. The common cold, which is an upper respiratory tract infection, shows signs of runny nose and congestion. Those are not a part of patients that actually have coronavirus. So it is easily identified. Those who are suspected to actually have coronavirus in the first place, they're going to present with the following items, and I'll give you kind of the breakdown. Number one is fever. Okay, not super high fever, because that can usually state other types of viral flus. But a fever, in essence, is 88%. Dry cough, dry, not wet cough, is 68%. Fatigue in 38%, which also comes with other things like malaise and chills. Sore throat at 14%. Headache at 14%. Chills, and nausea and vomiting, and stuffy nose. Again, notice that it's not a runny nose, just stuffy. And again, the most important, if you've had any contact with patients with the coronavirus and or you have been traveling recently, and I know that there's a new ban, if you do travel outside of the country and come back in, you will be what's considered self-quarantine for about 2 weeks before able to be reintroduced to the outside world. The coronavirus versus something else. There is an amazing picture if you go on our blog at nomonaja.com/blog/health and wellness. You will actually see the differences between the three items, whether it's a cold, a flu, and or whether it could be the coronavirus. The spread of coronavirus through the exposing droplets to the outside world happens through coughing, blowing your nose, and of course vomiting. To help you prevent the spread of disease and to decrease your risk of nausea and vomiting using natural means of essential oils and pressure technology, this is something that you can get delivered directly to your door through a product called No More Nausea Wristband. So No More Nausea Band is actually a patented 3-in-1 mechanism that's trusted in hospitals in various different countries to help decrease nausea and vomiting after surgery, for chemotherapy and cancer, for cold and flu, and for labor and delivery suites. But you too can also get it from a retail perspective. But again, it helps to decrease the spread. If we know that upchucking is going to cause it, let's make sure that we don't put ourselves and make ourselves susceptible to such. Remember that all these retailers that I have listed, from CVS, Bed Bath & Beyond, Bye Bye Baby, Walmart.com, and Amazon, you're happy to go online and or pick them up in store. But I would highly suggest ordering something online. According to the CDC, it takes 2 to 14 days to show the signs of the virus that you've been exposed. Most people are infected via respiratory droplets from close contact with someone who already contains the coronavirus. In more severe cases, the infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Not all who get infected will die. So how soon you recover depends upon your immune system. Those who are obese or have low immunity, such as children, very young children, or the very elderly, have been reported to develop more serious sequelae and are likely to die from the coronavirus infection. Pregnant women, believe it or not, are a little bit more susceptible and immunocompromised, but we'll talk a little bit more about that. Now remember, you're still young and you have a great immune system, so build it up now so that you don't have any troubles later. Can you get the coronavirus twice? Most people infected with the coronavirus globally have had mild viral symptoms and have recovered, according to the World Health Organization, or WHO. Those individuals infected with the coronavirus 19 have developed protective antibodies, but it's unclear how long these protective mechanisms will actually last. The cases who've acquired pneumonia, such as a result of the COVID-19, can get pneumonia again, and from a respiratory perspective can actually get more severe because their immunity is already compromised with their body dealing with once or getting it the first time. Interestingly enough, the University of Texas Medical School found that children develop some sort of short-term immunity. They actually become a little bit more immune, just like the flu, but it can mutate. So, making anybody else susceptible for reacquired infection. So the answer, yes, you can get the coronavirus twice. Effects of the coronavirus infection for pregnant women. What do you actually need to know? Well, pregnancy comes with a lot of challenges. Usually you will experience both immunological and physiological changes when you're pregnant. These changes will make you more susceptible to viral respiratory infections like COVID-19. But there is no scientific evidence that shows you whether being pregnant will make you more susceptible as compared with the general population. But by the nature of pregnancy, you are in a short term immunocompromised. Coronavirus infections make you experience high fevers. A high fever during the first 3 months of your pregnancy may increase the risk of certain birth defects. Other adverse pregnancy outcomes that have been reported, such as with SARS and also with MERS, include miscarriage and stillbirths. With the COVID-19, no adverse pregnancy outcomes have actually been reported, and of all the 20 cases that have actually delivered, none of them have suffered death due to the coronavirus, and none of their children have actually been born with any type of death toll as well.
Tips and tricks to stop the chuckle that you need.
All right, so let's get into the tips, right? So we need to fix your immune system. If you're pregnant, let's really build it up. So pregnancy alters that immune system. And how does it do it? A pregnant woman's immune system is heightened in the state of the first 12 weeks of pregnancy. In order to become pregnant, the embryo must successfully implant by the mother, flooding the mother's immune system cells into the lining of the uterus, also called the womb. In such cases, this inflammation makes it sticky. And being sticky, it allows the fertilized egg to hold on to the walls. Now, organogenesis, which is a big word for the development of the baby's organs, actually occurs between the 8 and 12 weeks of pregnancy. Hence why a mom has to be nice and strong and not have any outside interference. But a mom can actually attack their own unborn child. This is why the mother's immune system after 15 weeks is repressed or decreased in order to allow the baby cells to grow and develop properly. A mom's immune system has to take a chill pill. They have to relax in order for some babies, because the dads actually carry antigens that have been passed through to the child. And if the mom's immune system is at full forces, it can actually put this baby at risk and can actually try to fight against it because it has the antigens of the father still there. And the mom can make antibodies. And again, you have to remember that you don't want an inflammatory response until you go back into labor. So your immune system kicks back up into hyperdrive during the 3rd trimester and helps with labor because, again, you want that inflammation response as you go to give birth to kick that baby out and give it a wonderful eviction notice so that you can see a gorgeous baby. And remember that the mother is going to be innate to breastfeed. And when breastfeeding, you're going to be producing antibodies to give to your beautiful new unborn child. But remember, you have to do it every 2 hours because that is the length of time that the antibodies you provide of breastfeeding will wear off. So that's the reason why they say moms stay up all the time. I know because I'm a mother of 2, and let's just face it, I was up breastfeeding all the time, but my babies had very good immunity. So transmission during pregnancy or delivery. The current studies show that no pregnant mothers have actually transmitted COVID-19 during their pregnancy or delivery. This is the area that needs a little bit more research though. Some peer-reviewed literature from 18 relative studies have shown that mother-to-child transmission of coronavirus does not occur. 19 women with COVID-19 delivered 20 babies, and of these 19 women, 3 of them, which is 16%, were completely asymptomatic. They didn't even know that they had it in the first place. 1 mother, which is 5%, was admitted to the ICU, and no maternal deaths have been reported. 15 babies who tested showed no evidence of vertical transmission, which means from the mother to the baby, during the pregnancy or delivery. And as the method of delivery was split, about 17 of them had a cesarean section and 2 had a vaginal delivery. It is important to note, though, 42% of women hospitalized with COVID-19 had preterm deliveries, and only 1 neonatal death was actually recorded. No virus has been detected in the amniotic fluid samples, so you will not pass your infection to your child while pregnant, during delivery, or after. Remember that inhaling the respiratory droplets from an infected person with coronavirus remains to be the main route of transmission. So, although infants born to mothers positive during the coronavirus have not actually gotten it from their mom, they could potentially get it while breastfeeding. So I want you to note that besides these long-term health effects of the infants born to mothers that are positive to the coronavirus, no infection has actually been shown inside the child. So smile. That's a little something to feel good about. Transmission through breast milk. No viruses have been detected in the breast milks of the mothers that actually have coronavirus. It is therefore not possible to transmit an infection to your baby while breastfeeding. Human-to-human transmission of the virus happens by close contact through respiratory droplets, like we keep saying. So if you're infected with coronavirus and you cough or sneeze while you're breastfeeding, you put your baby potentially at risk. Standard recommendations in infection. So how do we prevent the spread? It's recommended that you take precautions every time that you go anywhere and with your own family, and especially if you are pregnant. The flu vaccine is also important. It's not going to help treat against coronavirus because we don't currently have a vaccine for it yet, but it helps to build those immune systems of contracting anything else that could potentially be wearing off all at the same time. The infection of breastfeeding while still breastfeeding, make sure that you wear a mask, okay? Or express your breast milk. Remember that the coronavirus has not been detected in the breast milk, hence there are very low chances of transmitting the virus through your breast milk to the baby. And those who are quarantined, of mothers that have coronavirus, should also be quarantined with their child. Just remember to wear a mask. So get your household ready for the COVID-19. What do you need? No, you don't need 500 million rolls of toilet paper. No, you don't need a gajillion gallons to fill up 7 bathtubs of antibacterial. Remember, wash your hands. It is considered the most incredible way as an antibacterial and antiviral to decrease the spread. Remember, when you wash your hands, do it for 20 seconds. Make sure that you scrub underneath of those nails really good. Sing happy birthday. Okay, that will give you the total time of 20 seconds, but make sure that it's long enough. And don't just wash the front, wash the back also, and up the small forearms. Use hand sanitizer that is at least 60% of alcohol utilization, and that is not a substitute for washing your hands. So again, what's the moral of the story? Wash your hands. Covering your mouth and nose when you cough or sneeze. Do the vampire cough like I always teach my kids. You reach around, cough, and or sneeze. This way that you're not touching everything else as you continue to go. Immediately dispose of any type of bodily fluids. So again, use disposable items, toilet papers, tissues, all of those things. Blow your nose, throw it away, wash your hands, okay? Don't go to work if you're currently sick. Even if you have something else, it doesn't mean that you can't be more susceptible to acquiring something when your immune system is already low. Clean, frequently touched surfaces such as tabletops, countertops, light switches, doorknobs, cabinet handles, and make sure that you use a detergent first, then water, so such as a soap first, and then a disinfecting product. A list of environmental protection agencies, which is the EPA approved products that actually work on coronavirus, have been provided by the American Chemistry Council Centers for Biocide and Chemistries, the CBC. And I actually have a link to their website so that you can see, are you buying something that actually will help stop the spread of coronavirus? Avoid large crowds, sporting events, airports, cruises. In this country, we have done a really great job of kind of cutting out all of the big events. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing. Avoid unnecessary travel, especially to regions or countries where the outbreak has been reported. Get lots of sleep, 8 to 9 hours of sleep, and keep your stress levels low. Remember, cortisol is the actual stress hormone that actually lowers your immune system. Some of us ladies have known, if we've already had one child, that cortisol or that stress hormone actually helps us to hoard fat. So you don't want to do that either, especially if you're trying to get down those extra 10 to 20 pounds from those beautiful babies that we've birthed. Eat a plant-based diet full of colorful vegetables, fruits, high-fiber foods, and that will actually help to build the flora of your gut, which naturally increases the vitamins and minerals that you're acquiring inside your body and your immune function. For a list of what you should be eating during your pregnancy, click on over to Pregnancy Pukeology Podcast, episode 16. And this doc will tell you all about it. Now, make sure that you're cooking your meats thoroughly. Meats and eggs, believe it or not, you can actually acquire different bacterial infections from uncooked meats. Now, there's a bunch of long laundry list of things that women shouldn't have, such as big, huge seafood fish because of the mercury, also because of uncooked foods such as like the potato salads and lunch meats that have really high nitrites and things like that. And you have to remember that all of these things are done so that your immune system isn't compromised. If you want more on what you should not be eating during pregnancy, again, Pukeology Pregnancy Podcast, episode 5 has got you covered. The 5 takeaways that I want you to really grab from this is: wash your hands for at least 20 seconds. Sing happy birthday if you have to. 2, cover your face and elbow cough. Boop. Just like a vampire, when you cough, sneeze, or do anything where spit little droplets could come out of your mouth. Number 3, don't touch your face. And number 4, stand 3 feet or more away from other people and don't get into crowds of 50 or more. Just try to stay home, especially number 5, if you are sick, don't go to work. So I actually created a little song for my kids personally. I'm going to share it with you, and I hope you all don't super make fun of me for it. Ready? So hands and elbow, face and feet, face and feet. Hands and elbow, face and feet, face and feet. Don't go out to play if you're feeling sick today. Hands and elbow, face and feet, face and feet. And those were the last 5 things that I really wanted you guys to get from everything. Remember that now you actually know the science behind the coronavirus, the COVID-19. What are the symptoms of coronavirus versus the common cold or flu, the effects of coronavirus in pregnancy and during delivery, and of course the tips on how to manage it from my beautiful song, which don't feel afraid to sing it to your kids, but also your breastfeeding recommendations and how to help prevent the spread or acquire the coronavirus itself. If you love Pukeology Podcast, let me know with a 5-star rating for hearts or likes. Don't forget to download this episode, but more importantly, share it with all your Prego friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 33, Coronavirus and Pregnancy, What Pregnant Women Need to Know About the Coronavirus.
Pukeology Podcast, edutainment at its finest.